All right. Hey, we're back here for the Target Continuum podcast. Super excited for our guest today. We're here with Lance Bradshaw from Intermountain. Lance, hey, welcome to the show and thanks for joining us.
Hey, good morning. Thanks for having me.
I'm also here with Preston Smith. Preston, actually, I'll kind of put you on the spot here, maybe to start us off. I'm wondering if there's something in particular that you hope to hear from our conversation with Lance, like something that you're kind of keyed into, like, hey, hopefully we hear this kind of thing.
Yeah, definitely. I think Lance is going to have a really unique perspective on not only marketing, but just healthcare in general and how that whole kind of monster of a system works. So, like I said, hear that unique perspective and be able to kind of take a deeper dive into that.
Fantastic. All right, well, let's get into that. And Lance, let's give you a chance to introduce yourself. Tell us a little bit about who you are, kind of what your role is, and your title there at Intermountain.
Sure, absolutely. So, yeah, I currently serve as the Director of Workforce Transformation. I sit under the HR umbrella, but we really touch all areas of the organization. So, Intermountain Health is a large nonprofit health system. We're based in Salt Lake City, Utah. But we have expanded our footprint now to 6 states. So we now cover 35 hospitals and over 400 clinics across that footprint. But my role in particular, so we have over 68,000 employees that we call caregivers now at Intermountain. And with that, as we're all aware, healthcare continues to evolve and change. So my role specifically is over workforce transformation. So what that means is, historically change management has always been about evolving and adapting and making sure that you're ready for kind of the next challenge. But really over the last, I would say 10 or 15 years, particularly with AI and the significant impact that that's having on all industries, but healthcare in particular, we have to transform and we have to evolve. We not only have to just be ready for change, but we have to drive it and be ready to accelerate adoption and the impact that it's having on our patients. So that's a little bit about my role. I'm happy to, as we kind of go through this conversation, talk a little bit more about what that entails, but at a high level, that's what workforce transformation at Intermountain is all about.
Maybe we can drill down on this a little bit. The whole thought of HR transformation, workforce transformation, that feels like a pretty novel function in itself. I guess I just haven't heard that title a whole lot. What are some of those specific problems that you're looking to address in the organization?
Yeah. So it definitely has evolved. As I already mentioned, change management has always been an important part of healthcare, but just for organizations to thrive, they have to continue to adapt to not only their customer needs, but internally. What are the dynamics that are happening? What are the pressures that are on healthcare in general? But for Intermountain in particular, as a nonprofit, we don't have shareholders. We can't go out and raise money if we're, going to come up short in a budget year. So we have to continue to think about ways that we can work smarter and really leverage our workforce because at the end of the day, that's our greatest asset. So it definitely has evolved through a change management philosophy, but also a continuous improvement approach, right? So we've never reached, that perfect state where everything's fine and we just can sit back and let things just hum along. We're constantly looking in healthcare how we can improve patient care, how we can do better, how we can deliver better care at a more affordable rate.
Maybe this is a place we could dive in a little bit deeper in terms of like how AI helps specifically with some of these things. We're talking workforce challenges. So me and my limited, experience here, I'm thinking like talent management, maybe internal communications and
Yeah.
culture. I would guess those are maybe parts of that workforce.
Yeah, absolutely. You hit on a couple of them there. I would say kind of to your earlier point, there are so many tools, right? I mean, you can read the headlines every single day and there's a new functionality, whether it's in, a publicly available like a chat GPT or a Microsoft Copilot or little niche kind of, AI startups that are coming out with just incredible tools that can really automate, if you wanted it to, your entire day, right? You could wake up and tell Alexa to do this and Siri to do that, and you can have Copilot read all your emails. So there is just an enormous amount of tools that are available. So transformation isn't necessarily about just quickly moving on to the next tool and trying to accelerate technology in itself. It's bringing the human along on that journey, right? It is making sure that we are leveraging, as I mentioned earlier, our greatest asset is our people. And so we want to make sure that not only we're giving them the right tools, but are we setting them up for success? Are we upskilling or reskilling them appropriately? Another component is psychological safety, right? A lot of people feel intimidated by these tools to say, is AI going to take my job? If I adopt these tools, am I actually putting myself out of a job by being more efficient in my role? Do I actually need to slow down so I don't push myself out of a job? So those are real challenges that we're working through, and HR is right at the center of that. We we really view ourselves as the people experts. And we want to make sure that we have a good finger on the pulse of how are people doing? How are they feeling about the tools that we're trying to implement? Do we need to pause and make sure that from a change management perspective that we do a readiness assessment, not just check all the boxes and say, yep, we're good to go from an implementation perspective. That'll come, right? That's the technical side of it. But we focus on the people side. We want to make sure we get the right tools in the right hands, but that they're ready to use them and that they feel safe. And it's okay to fail, right? We've heard that fail fast or that fail forward mentality where let's experiment, let's iterate, let's figure out what maybe doesn't work. And then on the way there, we're going to figure out a really, really good way to deliver good care to our patients, take care of our internal caregivers, make sure that we're delivering on all those promises that we have. Because healthcare is a lofty mission, right? To take people's lives in your hands, and the trust that they give in you to deliver that care. It's a lofty goal, but it's one that we feel at Intermountain that we're ready to continue to deliver on.
It's amazing. Tell us about kind of what's in the middle of your radar screen these days, start of 2026.
Yeah.
What are some trends or issues or things that you're just following really closely?
Yeah. Yeah. Interestingly enough, what we've kind of already talked about always sits right in the middle of our kind of strategy deployment exercise, right? We want to start there. We want to start with the people. But a couple of things that come to mind for this year is as we continue to grow, there are workforce shortages across the nation, right? And healthcare is not unique in that aspect, but it is, we do not have enough nurses, we don't have enough doctors, we don't have enough occupational therapists or imaging techs. There just are not enough people to do all the jobs that we have. And so we have a separate but related function that does all of our strategic workforce planning. And so we want to make sure that, as I mentioned earlier, that we are looking beyond kind of the next week or the next month and make sure that we're setting ourselves up for success. One other thing I'll just mention with AI in particular, it's one thing to flip the switch on a really cool AI tool, but it's another thing to make sure that it's not, introducing bias into your processes. If you're using it for recruiting, for example, are you making sure that it's still consistent with your values and what you're legally obligated to screen for? And so that's another thing that we're constantly looking at is how do we not only keep the human in the loop, right? We've heard that over the last couple of years, but we like to say the human at the helm. How are we controlling the technology to make sure that we're making really, really good decisions? One of our compliance individuals likes to say that let's make sure that we have our governing frontal lobe into every decision that we're making. Don't just turn it over to the technology and trust that it's going to do everything you need it to do. And so we have a full responsible AI governance committee that we sit on and make sure that we're really thinking about not only the immediate need, the problem that this can solve, what's kind of the long-term effect of bringing on some of this really exciting technology, but let's be thoughtful about how we adopt it. So those are a couple of things that probably right in the middle of my radar as we start this new year.
Yeah, Lance, and my ears perked up when you mentioned recruitment. I'm just curious to hear from you. I speak with a lot of healthcare marketers every day that talk about recruitment, but I feel like there's not a ton of knowledge on how they can truly help with it. So I'm curious from your perspective, how can healthcare marketers really help with recruitment? And then what kind of separates those recruitment efforts that truly convert candidates from those that are just kind of generating interest?
Yeah. Yeah, that's a great topic because at the Chiprins conference that you and I met at, this was definitely a theme there. And so I spoke a little bit about how we break down silos where, historically, and I'll just speak specifically of healthcare, everyone has their disciplines, their areas of expertise, and they're really, really good at it, right? But the unique challenge with a large complex system is that you can't work in silos and just trust that, okay, everyone did their job. So that means the end product magically just works out like everyone thought it would, right? We really have to focus more cross functionally and break down those silos. And so I think a part of how marketing and HR and recruitment can continue to work together is make sure they have those consistent touch points, make sure that they have shared goals, right? They're not going to be identical, right? Because we do approach it from our disciplines and the unique skill sets that we have, but make sure we're working towards some of those common objectives. So having whether it's shared work groups or maybe a quarterly kind of strategic discussion with your leaders across those different disciplines, making sure that those goals are front and center for everyone and that we're working towards those. The other thing that I think I heard at that conference in particular, but a few times since, is marketing. You guys are the storytellers, right? You get to tell the story of the organization. You get to show what the organization is all about. And HR historically, we're not great at that, right? We stick to the facts. We need to document. We need to just put down on paper and get data. And so where I think we can kind of blend those two approaches is there is a lot of really good stories to tell in not just in HR, right, but across the entire healthcare ecosystem. Great patient stories, great interactions that our caregivers are having with those patients. Our team does a significant amount of community service and volunteer work. Are we telling those stories so that potential candidates or future caregivers can see those interactions that we're having? Honestly, if you were like me, I was a patient of Intermountain's way before I was an employee, right? And so I had those interactions. I knew through the power of we, which is one of our campaigns that we really promote here in the state of Utah. I'd had those interactions, and so when it came time to look for a new role, Intermountain was the top of my list, right? Because I'd had those experiences in that interaction, and so I think maybe just the last thought there, Preston, is there's a lot of noise in the market, right? We're competing for talent, just constant. We probably all get just bombarded on whether it's LinkedIn or text or emails, people saying, "Hey, come work for our organization." So we realize that there is a lot of noise, but that's where I really think marketing can help us find that signal in that noise, really hone our message, and that way, potential candidates can see the difference that our organization can make in their career versus, maybe some other options that they would have with that. Those are a couple thoughts on how we can continue to break down those silos.
Yeah, that's awesome. And it's so cool that like you explained you had gone through it yourself and that played a major role in landing you at Intermountain Health.
Yeah.
So I'm curious in healthcare, obviously, how important do you view the authenticity in recruitment, storytelling, for example, like a more polished messaging and kind of the balance there
Yeah.
from a healthcare marketer's perspective?
Yeah, it is kind of a fine line, right? Because I do think um, our candidates and even our patients are very, very aware of the information that's available, right? They're very astute. They're just a different type of consumer maybe than we had in previous generations, right? Because they have so much information at their fingertips. They can quickly Google your organization. They can look at, nowadays you're asking Chat GPT, "Hey, what's the best doctor?" Right? So there's all these data points that maybe historically our patients and maybe our potential caregivers didn't necessarily have access to. So they're pretty quick at picking up on, things that maybe is just the fluff, right? Where it's like, yeah, I know you say that, but I've actually talked with people that work there and it's not consistent. So they're very very good at kind of seeing through that. Where I think it's important is that you do find those really good opportunities to highlight the times we did go above and beyond, not only for our caregivers, but our patients, right? And there, of course, there's some, patient confidentiality where we can't just broadcast every good patient story. We need to work through the proper channels for that. But if we have a really good experience, we need to tell those stories because that then becomes what people gravitate towards. We will be the first to claim that we're not perfect in every area, right? There's no such thing as a perfect organization. So anyone that's claiming that, that's probably a bit of a red flag to say, maybe I'll keep looking." And so we don't go out there and pretend to be, perfect in every area. Where I think we've really shined over the last, like I mentioned, we've been around for 50 years, but I would say over the past 20 or 30 years where we've continued to be recognized is that we do have that humility to say we are not where we want to be yet, but we continue to get better every single day. And so whether it's the 1% philosophy or just find something to maybe step outside your comfort zone, right? Because that's where true growth happens. Just push yourself a little bit today, right? You don't need to go out and um, cure cancer tomorrow or, solve world hunger, but let's figure out how we can do a little bit better tomorrow. And I think candidates will see that as they talk with individuals that work for the organization. People want to join an organization that they feel really good about. the paycheck's important, life's expensive, but I really want to believe in what I'm doing. And so those are probably some of the thoughts that I have on the question that you asked.
Yeah, that's great.
Great.
And as you mentioned, I think there have been cases where like an overly polished story can actually hurt credibility. So it's important to just kind of be real and maintain your identity throughout.
Yeah, I think just as we wrap here, I'd love to just hear like anything else we haven't talked about that you would find helpful to share with healthcare leaders. Maybe it's something that as you look back in your career, like it's something else that you wished you knew as an earlier career professional, as an up and coming leader, or maybe it's just something about like thriving at a large organization like Intermountain. Just anything else we haven't discussed yet.
Yeah. Yeah, I would say if I look back, some of the opportunities that maybe I didn't fully take advantage of or just missed completely was because I was maybe inside my own head too much, right? I think sometimes you just need to take those risks, right? You don't need to be reckless by any means, but I think there's truth to I mentioned it just a little bit ago around growth happens just outside your comfort zone where you do need to push yourself. I think we like to feel confident and competent in the things that we're working on. And so we tend to gravitate towards those things that we're really, really good at and we can show up and do consistently. And that's important, right? I'm not saying we should just all abandon our strengths, but I would encourage people to look a little bit more on what are some of those weaknesses? What are some of those areas where I'm self-aware enough to say, yeah, I know that I'm not super great at that, right? Like for me, public speaking, I still struggle with it a little bit, right? I enjoy doing it, but I don't see myself as super polished or great at it. So this right here is a great opportunity for me to step outside my comfort zone a little bit, to push myself and see where maybe some new opportunities are that maybe you hadn't considered previously. So I would encourage people. Healthcare has so many opportunities. It is not going away, right? It's not just a little blip where, well, it'll just move on and people start doing other things. Healthcare is always going to be needed. And in fact, I think particularly with aging populations and all the unique, dynamics that we have within our society and just everything that we're dealing with, it will continue to be there will continue to be significant opportunities to push new ideas and new thoughts and new skills that we really haven't even thought of yet today. So be assertive, be humble still, right? You don't want to be the know-it-all in every discussion, but put yourself out there a little bit, and I think you'll surprise yourself. But also, people will pick up on that. They gravitate towards people that have that humility enough to say, I want to learn this. I'm not sure what this is even about. Let's talk about it. Let's explore this a little bit further. And I think those are the types of discussions that we need to have. And so that I was to tell myself 20 years ago when I was starting my career, I'd say focus on that a little bit more and not so much on maybe see some of the other things that probably weren't even that important, but they seemed really important at the time.
For sure. Lance, we appreciate the time and so many insights that you just shared with us. And thanks for your perspective. Thanks for everything you're doing there to make healthcare a better place, to connect with patients. And we truly appreciate it.
Thank you both. Appreciate the time.
Thanks, Lance.